Hello, my presentation today is 10-year occurrence rates and clinical characteristics of portomesenteric and splenic vein thrombosis at a community hospital. Portomesenteric and splenic vein thrombosis refers to the complete or partial obstruction of blood flow in the portal vein and its branches due to the presence of a thrombus. Liver cirrhosis has been described as the most important association for PMSVT. Other notable associations include coagulopathy, abdominal malignancies, post-surgical state, infectious or inflammatory conditions like hepatitis and pancreatitis. Based on available literature, its symptoms are often non-specific and require a higher clinical suspicion. Further, it is associated with complications like ascites, esophageal varices, and terminal gastrointestinal bleeding. It is a potentially lethal condition with overall survivals of 69 and 54 at 1 and 5 years respectively. We did a retrospective observational study going back 10 years with the goal of identifying the demographics and comorbidities among population of patients with radiological evidence of PMSVT at St. Mary Mercy Hospital. The study period was from June 1st, 2008 through May 31st, 2018. Inclusion criteria were adults over 18 years of age who have a radiologically confirmed PMSVT. Prisoners were excluded per institutional policy. We identified a total of 72 patients and data was collected using the software REDCap. A statistical support was provided by methods consultants. The analysis was performed using R version 3.6. The results are presented as descriptive statistics. Measures are grouped into 3 tables for diagnosis modality and type, demographics, and comorbidities. Within table number 1, we notice that portal vein is the most common location of PMSVT in this cohort. CT abdomen with or without contrast was the most common radiological study used to establish diagnosis. Table number 2 focuses on demographics. The study population was split evenly between males and females, with 35 of the 72 patients being male and the rest being females. The other notable feature was that 12.5% of these had a prior history of DVT or PE. The average age was 62 with a standard deviation of 16 and the average BMI was 30. Coming to table number 3, we notice PMSVT was an incidental finding in 23% of our study population. Hypercoagulability has been detected as a risk factor in 2.9%. Surgical data seems to be the most unique at St. Mary Mercy Hospital. Of the 11 patients who underwent surgeries, 8 were bariatric surgeries. I'll discuss the pertinence of these numbers in the next slide. Based on our study, the frequency of cirrhosis in PMSVT cases is 30% when compared to that reported in literature. More importantly, the proportion of patients who had PMSVT in the background of surgery is higher at our hospital, 15 versus 5%. It is worthy to note that 72% of these were bariatric surgeries. It is important to recognize this higher proportion since it's a potentially preventable cause. Now, it raises the question if we should use a more aggressive anticoagulation protocol in this subset of population. It has a potential for improving outcomes in these patients as shown by a recently published systematic review and meta-analysis by Rajni et al. Thank you for allowing me to present my work at SEMCME 2020 Research Forum.